Royals, good morning. My name is Akua and it's time for Medical Talks. And today on the show, we are going to discuss about an interesting topic. Today, our topic for discussion is cardiovascular accident or stroke, commonly known as. And I have me here, a very nice gentleman that will be discussing issues with. But before I introduce him, I'll urge you all to go onto YouTube and subscribe to my YouTube channel at Medical Vibes. And also follow me on Instagram at Akua and on Twitter at Akua as well. We're going for a very quick commercial break. When we come back, the show begins. Stay tuned.
Great. God is working EP. This EP is actually to motivate a lot of people and to keep them on guard. Tell 'em. It's only Christ who can give them.
Welcome back after the break. It is Medical Talks happening live at Money's Media and More. And today, my guest, he is a speaker, a writer, deaf health advocate, and a physiotherapist professional. Welcome to the show, Mr. Delasi.
Thank you, madam.
You look good.
Thank you so much.
Mr. Delasi, based on the hospital statistics, it has shown that many people that come to your department for treatment, usually they come with a diagnosis of stroke. Can you enlighten us on what stroke is and the causes?
All right, thank you very much, madam. And a very big thank you to our cherished viewers as well. The condition stroke, or what we call in the medical terms cerebrovascular accident, is one of those serious conditions or health conditions as we speak, not only in Ghana, but also across the world. Because statistics have made us to understand that stroke is one of the diseases or the conditions that causes a lot of death. The number 3 or the third number of condition that causes death. So it tells us that the rate at which people get stroke is on the rise. Now, when we talk about stroke, what comes into mind? Stroke, the medical terms is cerebral. Cerebral referring to the brain. Vascular referring to the blood vessels. And then accident as in by way trauma or an unusual happening, an injury to the brain. So when we talk about stroke, we are talking about a condition which happens or occurs as a result of lack of blood supply to certain parts of the brain cells. Now, mind you, the brain and other body tissues receive energy, nutrition, good air by way of oxygen for the body to function well. And all these supplies come through the blood. And what happens is that when this blood that is going to the brain cells for nutrition, for support, for movement, and all these things, when this blood is obstructed by way of rupturing of blood vessels or by way of obstruction, then one is assumed to get stroke.
Okay. So if I get you well, you're trying to tell us that stroke comes about when there's a plaque, right?
Of course, that's one of the most common.
Thrombus. Okay.
Yes.
Okay, that blocks the blood vessels.
Yes.
That sends oxygenated blood to the brain.
Yes.
Okay.
Yes.
Thank you so much. Do we have what causes it?
Now, we have the basic cause of stroke as when blood that is supposed to get to the brain cells is obstructed. Yes, so it tells us that
plaque or thrombus can be a
of
cause.
course that is
Okay.
true. A plaque, a fatty deposition or debris in the blood vessel can block the blood vessel and then thereby making blood to be difficult or to prevent blood to reaching the brain cells. So when that happens, we can get stroke. Secondly, as one ages or as the blood vessels in the human body by way of the brain, they become weak. There is what we call rupture. Rupture can occur. This means that when the blood is flowing through the blood vessel, all of a sudden an accident, an injury can occur whereby the blood vessel can become busted. It can just get burst and then blood does not get to the other part of the brain, but rather blood oozes into the brain and one is prone to getting stroke.
Okay. Is there any disease condition that can regulate it to getting stroke?
Of course, there are lots of medical conditions that when one gets that condition, it can lead to stroke acquisition. A typical example is diabetes mellitus, DM, and when one is hypertensive. As a matter of fact, hypertension is the number one risk factor for stroke. So when one gets a condition we call facial paralysis or Bell's palsy, the person is prone to getting stroke.
Do we have types of stroke?
Yes, of course, we have various types of stroke, and basically we have two types of stroke. The first type of stroke, or the number one type, we call it the ischemic stroke.
Ischemic.
Yes. When we talk about ischemia, what it means is that, just as I mentioned earlier on, it is the blood supply that goes to the brain and other body tissues for the normal function of the body. Now, when this blood that is supposed to go to the brain cells doesn't reach the brain, then ischemia sets in. Now, under ischemic stroke, we have two subtypes. One, thrombotic stroke, and two, embolic stroke. Now, the embolic stroke happens in this way. When fatty deposition or clot of blood obstructs the blood vessel, then one gets embolic stroke. Now, the thrombotic stroke happens in this way. When a plaque, just as you mentioned, or a debris is attached to any of the blood vessels or the blood vessel walls, what happens is that blood flow becomes so difficult, and thereby causing the heart to pump more blood. And as more blood is being pumped and the pressure is increasing, it can lead to that obstruction, and then one can get stroke as well. Type 2 of stroke is this, what we call the hemorrhagic stroke. Hemorrhagic simple involves blood. When I was talking earlier on in my introduction, I made mention of the fact that blood vessels can become weak, or a trauma, an accident, or an injury can occur to a blood vessel. When that happens, the blood vessel can burst, and thereby preventing blood from flowing to the brain. Though the blood vessel can become ruptured, and then one gets stroke. So basically, we have two types of stroke: the ischemic stroke and that of the hemorrhagic stroke.
Okay, so if you just joined this medical talks and we've already talked about what stroke is, and then we also mentioned that we have two main types. We have ischemic stroke and then hemorrhagic stroke. And we also discussed about some of the causes or risk factors of stroke. So we made mention of diabetes mellitus and then blood pressure, and then he also talked about atherosclerosis and arteriosclerosis. Mr. Delasi, what are some of the clinical manifestations associated with people that have stroke?
Okay. When we talk about clinical manifestations, what we actually referring to are the various signs and symptoms that we can see, we can feel and experience that this person is having stroke or this person is living with stroke. Now, first of all, when one is likely to get stroke, normally the person experiences severe headache, some dizziness, and then sometimes inability to walk. And when one gets stroke, what we can see is that generally we have what we call hemiparesis, or what you call one-sided weakness. Hemiparesis because when the right hemisphere of the brain is where the damage was caused, the manifestation will be seen on the left. You see that your left side is weak. Your upper limb, which is your arm, and your lower limb, which is your leg, there is total weakness. Normally, you can't even move the hand. You need lots of support. Also, the person's speech can also be, there can be some malfunction in the person's speech because there are certain portions of the brain. We have various lobes and various areas in the brain. And every portion in the brain is responsible for a certain function on the human body. So if it affects the vision center, normally the person can't have a very clear vision.
Have a blurred vision.
The person might get a very blurred vision. Also, when it affects the speech center, that is Broca's area, the person by that means will not articulate speech very well. So we can also talk about, apart from the weakness, apart from these two that I've mentioned, you can also see that the gait pattern or the movement, how the person walks, it all changes. You can also sometimes in some cases see that there is weakness on the face, and also you see that the mouth, if it involves facial paralysis as well, you see that the mouth is twisted to one side. So these are some few clinical manifestations that can prompt you or can tell you that this person is having or living with stroke. Mind you, we can also talk about incontinence in some cases because the injury that is caused, the manifestation happens, and then one person experiences weakness. And then we can also talk about the fact that the person can't be able to control urine and bladder function. So in some cases we have incontinence. So these are some of the clinical manifestations. Earlier on I spoke about the one that would give you a green light that you are likely to get stroke, and also when the person has gotten the stroke, what we can see, experience, or feel about the person.
Okay, so if you just joined, it's Medical Talks, and today my guest is a physiotherapist. His name is Mr. Delasi. We're going for a very quick commercial break. When we come back, we have more.
Great. God is working EP. This EP is actually to motivate a lot of people and to keep them on guard. Tell 'em. It's only Christ who can give them.
Okay, so welcome back after the break. We are discussing about stroke, and I have with me here a physiotherapist. His name is Mr. Delasi. So, Mr. Delasi, can stroke be prevented?
Let us clarify this first so that our viewers know what exactly we are talking about. We have two different things to talk about. One, prevention, and also two, management. Now, as a young person or as an ordinary person who have not experienced stroke, what happens is that yes, there are some things you can do to prevent the stroke from occurring. For instance, the risk factors, as I mentioned earlier, we have age, we have gender, we have race, and then we have lifestyle. For instance, hypertension, we have diet, we have obesity, and so on and so forth. So we have two forms of risk factors. We have what we call modifiable risk factors and non-modifiable risk factors. I believe for sure you and I can't change our ages, okay? The race from which we belong, and also the family history, we can't change that. So it tells us that if somebody has ever experienced stroke in the family, one is going to get it. But the modifiable ones is, for instance, checking our blood sugar level by way of controlling or preventing diabetes, periodically checking and monitoring our blood pressure. It can also help us to prevent stroke. Checking our BMI, that is the body mass index, as to whether we are underweight, we are obese, and so on and so forth. Also diet. So basically, we can prevent stroke by way of lifestyle modification, how we modify our lifestyle. Eating of certain foods, controlling diet, checking blood pressure, and so on and so forth. That's by way of what? Prevention. Yes, of course, we can prevent. But for management, now one has acquired stroke, or one is now living with stroke. We can't say that we are giving total cure, total deliverance, total healing. But what we do is that we try to do management in the sense that we want to rehabilitate the person and reintegrate the person to come back into society, to by way of functioning, for the person to be able to do his normal duties, what we call activities of daily living, to improve on his or her quality of life. So we can manage the various symptoms or various manifestations you are living with in order to be able to reintegrate you back into society, for you to have societal participation and to do your other things that will help your livelihood.
So, is there any medical management?
Of course, we have various levels or various stages of management. We have medical management, of which the doctors would have to periodically check your blood pressures, give you certain medications, and also if by way having an embolus or any coagulation in your brain, yes, we can do those tasks for you, the medical management, to maybe dislodge those coagulation in your brain. Now, we also have surgical means that is more advanced, of which I will not switch into that. But our focus this morning should be tailored towards the physiotherapy interventions and management. Now, when one gets stroke, a lot of people think so wide, they think so big, and think that it can't be managed, or there's nothing I can do about it unless I wait for a God and then die. But mind you, there is a lot we can do. Physiotherapists are the main professional that helps in the management of stroke. So one is having weakness. When it comes to the physiotherapy department or any physiotherapy facility, we diagnose, we do you thorough assessment and check what the problem is. If you have weakness, you can work to improve muscle strength, and by that means you need to work. If you have limited range of motion by way of joint movement, we can work on that for you to become functional. If you have problems with your grip and your hand function, we can also work on that for you to come back to normal. If you have weakness on the face, any forms of manifestation that you are having, we can work on it. Physiotherapists are the best professionals in the medical field that can help you to be able to address and also attend to all these things. So, for instance, when you come to the physiotherapy department, the first thing we have to do for you is to assess you, to do thorough diagnosis, and to know which body parts or which of the body segments you have the weakness, by right or by left. Then we attend to you, and then we pick it up from there. We check your blood pressure level, whether you're hypertensive, you're diabetic patient, we do all those things. And we have various treatment protocols, from therapeutic exercises, massage therapy, and a lot of those things you can do. Mind you, people who have stroke too have challenges with walking, movement, and other stuff. So we have what we call assistive devices such as crutches, Zimmer frames, auxiliary crutches. We have wheelchairs as well. Those assistive devices we can give you, and then we see to it that you become functional and you become independent as well.
So what are some of the recommendations that people watching us having stroke, what are they supposed to do?
All right, to our viewers, my best and candid advice and recommendation to us all is that when you begin to experience stroke, and also somebody is living with you in your environment, in your home, fighting or battling with stroke, all hopes are not lost. The best point or the best intervention to do is that, one, refer the person to the hospital or any health facility, and then from there we pick it up. The person comes to the physiotherapy department, and we believe with the glory and with the help of God, our interventions can change the person's life and make the person functional and independent in society.
Thank you so much. Thank you so much for answering my invitation.
I'm humbled, madam.
Okay, so this is how we wrap it all up in this medical talk. See you in the next episode. Have a very good afternoon. Bye.
You know, this EP is actually to motivate a lot of people and to keep them on guard. It's only Christ who can give them what they need. As it's already written, with Christ there's life. What life is this? I'm just asking myself, what kind of life is this? Still asking myself, I don't know why things ain't going so well for me. And then born in Amaye, baby I'm a bisa me nyame se ombe ye bibi e mamio. Fesa me hu ye ramio.